I need to tell you I'm a little in awe because it's like old home week. I escaped the laboratory to work in the field a long time ago, but I then went into writing books and doing video production in the science realm. And about 2 years ago, I convinced the esteemed Dr. Francis that he needed to write his bio or his memoir or whatever you want to call it. But we are almost through with that book, and it's been the wildest journey I've ever attended in the entire world. He believes in forks in the road, and his forks, as he will tell you today, are pretty awesome. So I am kind of the stand-up entry person to set the stage for this, and this is the beginning of the first words of our book. As I stared down through the small window of the bush plane at the sprawling deserts of the African terrain, I thought, okay, dude, you've signed up for one hell of a ride. This is a big hunt. This is a bug hunt where the mortality rate is almost 60%. It's hemorrhagic, causes high fever, and then bleeding throughout the whole body, and worst of all, it's infectious. We don't know where it comes from. We don't know who could pass it forward. It also means you have chosen the highest risk gig of your entire life. It was the fall of '76. I was en route from Khartoum to Juba, the capital of South Sudan, and on assignment for World Health Organization. An unknown virus had jumped out of the forest and was killing a lot of people and decimating entire villages in its path. Our small team needed to figure out the who, the what, the where, and the why. I continued to stare down at the arid land of Sudan where the Blue Nile and White Nile snaked through the eventually to become the Nile River. We were now preparing for descent, and I mused to myself again, oh well, what the hell? You're here and it's showtime. What I didn't know was that I would be dueling with it not for 2 weeks suggested by WHO, but almost 2 months. All my life I had followed unpredictable forks in the road. Many times I had been up to my waist in infectious disease. But this particular fork could be the end of my road. Drama and risk had become my middle names. What called me to all this drama? Why was I here at such high risk? I guess it started when I was a kid. I've always been a downhill racer. With that, I introduce Dr. Don Francis.
Thank you, Geri, and thanks for all coming. It's always a pleasure to come back home in Department of Health Services, as I will get into in this presentation. When AIDS came, I was asked to make the first prevention plan for the United States of America. I was back in Atlanta at that time, CDC, and it went up to Washington. God, it was $21 million for a national program. And the leaders of this great country said, we're not going to fund it, look pretty, and do as little as you can. For those of you who've not witnessed federal government of the United States of America that continues, and the state has some similar problems, have an epidemic that had, at that time, in excess of 70% mortality. It was spreading like crazy around the country. I was trained for beginning out here, and then ultimately around the world, and was asked to make that plan, and was really slapped in the face by the government of this country, which continues to this day, at least I feel, and puts our population at great risk. And it's folks like you that carry on and try to make it better despite the weaknesses, and how to get around that and have boards of health and all that kind of thing is still a problem that we have, that you guys suffered with all the time. So with that miserable introduction, let me try to put it in perspective. You just dropped an important red thing, yeah. And what I will do is start about how I got into this to begin with, and then how I join the federal government at that time. We had the Vietnam War, and I was refusing to go, and they said, why don't you go to CDC? Because I was going to be a practicing physician, interestingly, in infectious disease, and went to CDC for 2 years of military service and stayed for 21, being shipped all around the world with smallpox and then Ebola, et cetera, et cetera. And I'll go through all that. And then comes HIV. And clearly with that kind of a background, we were prepared, we knew what we wanted to do. And I was asked to make the first national plan for HIV when I was told to look pretty and do as little as I can. And what do I do but ask to be sent back to California, where we could work with Jim Chin crowd to actually make prevention programs at this state, and which ultimately was models for the world. But it was a tough time. You guys are in the middle of tough times all the time. And I wish we had boards of health, interestingly, that would protect us from this kind of junk that just where politics and public health clash constantly that you see. Anyway, from then on, I went off to WHO and others to eradicate polio and develop HIV vaccines, and I will get into that quickly so that we don't exceed the time. Interestingly, for those of you, I come from a long background of California physicians, interestingly, where the grandfather, mother, and father, all physicians. But I was not a very good student, and no one knew why, but I couldn't spell, and I just limped along. But interestingly, the science things I could understand. I didn't have to read so much, could just learn from listening, and ultimately became a physician. But still have a hard time. I like to pick up a lot of books, but I seldom finish them, to be honest. So for those with you dyslexia or have children with dyslexia, it now is described, and it's a hell of a thing to deal with. But interestingly, we learn differently, and for science, it works very well because you learn by listening instead of reading. I, out of medical school, saw this sign on the wall saying International Fellowships Abroad, and it changed my career plans from being a pediatric doctor in Marin County to go on to a whole variety of infectious diseases that I'll get into in a bit. And this was the first. I was sent off to Nigeria to deal with tuberculosis in southern Nigeria. This is obviously an old picture where we looked at, there was this rumor there was a huge epidemic of tuberculosis. I went to skin testing and found there was lots of tuberculosis, but it was all part of a political issue. But at least I started learning epidemiology. But at the same time, cholera gets introduced to the same place. Cholera is a remarkable disease. It goes very, very fast and requires a huge amount of, interestingly, clinical care, which for a public health physician is a challenge. Because I was working literally during the day as public health and vaccine delivery, and at night taking care of kids as dehydrated as this by the hundreds. You can see the stool all over this kid because it just runs out by the liter. And remarkably, for even a public health physician, one of the most rewarding things you can do is have a kid come in with no blood pressure, and 10 minutes later with a little bit of saline, they start crying. Remarkable disease, both adults, and you can, if you see from the NG tube in this kid, awful lot of this can be prevented by giving oral rehydration fluid very early. Remarkable disease to deal with both therapeutically and preventively, since we still have a challenge with vaccines. So anyway, up comes the Vietnam War, which I was strongly against, and I was planning on leaving the country, and someone said, why don't you join CDC for 2 years in the Epidemic Intelligence Service? And I said, oh, that's a good idea. That was 1971. I went for 2 years of public health and have never left since then. I will show you. And initially, before I even got going, they said, where do you want to go for your CDC assignment? I said, California. They said, no, we don't send people home. So I said, Oregon. And it was wonderful. I had outbreak after outbreak of remarkable things in Oregon. But very rapidly came smallpox. And off I went at that time to the former country of Yugoslavia, where there was an importation from Asia of 175 cases with 35 deaths, and off I went. And here we have a vaccine's essentially 100% effective. Unfortunately, you have to, as you all well know, maintain vaccines with a proper refrigeration, et cetera, and they didn't, and it was dead. And so all these kids have been immunized over and over again and still got disease. So we came in from WHO and the United States government and vaccinated the whole country, and by thousands stopped it. This is what probably none of you in this room have seen variola major. This is what variola major looks like with about a 40% mortality. That's her face. Out of focus, look at the hands. It's absolutely confluent pustules and very, very sick people. So the world decides I come back home, and they say they want to eradicate smallpox, and CDC was going to be part of it with WHO, and I said I'll be happy to join. And off I went to Sudan first. Very difficult country. That's a Land Rover in blue out there. This is a highway in northern Sudan. Very difficult area, but a remarkable country with remarkable people that will clearly are going to go out and find every case and eradicate the disease. And we finished in Sudan and then went off to the greater challenge of Asia with the huge WHO program there. This was smallpox in India in the north, and that's where I was the head of the program in Uttar Pradesh, which is the northern state. And you see the number of outbreaks. This is not cases. These are outbreaks literally by the thousands across India. This is a lousy picture, but if you look at the leg of that little boy, this was village after village with smallpox. And this was my wonderful team of driver holding the vaccine and my paramedical assistant, Rajinder Singh. And we were the WHO team that was out to be sure that the WHO program that was going out there was being delivered appropriately. And this is interestingly the evolution of smallpox, which you might think would logically you'd vaccinate everybody. But Bill Foege, who becomes director of CDC later, is now the Gates Foundation after that, when he was in Nigeria, found out that he could not, he was vaccinating one village and found out the smallpox was in another. And he had only limited capability. And he said, well, let's find the cases of smallpox and vaccinate all the people around those and not just vaccinate the whole country. And very rapidly, smallpox disappeared in Nigeria. And so what he did was come back to WHO, CDC, and sent him to WHO like me. And so we send out whole teams that change this whole program. Very easy to identify smallpox, as you saw from that picture. It's very different than chickenpox and a very serious disease. And so ultimately it was search and containment, it's called, which was to search all for cases and vaccinate intensively 100% of the people around those cases, which really was the entire village, but not the entire country. And rapidly smallpox disappeared from the world. So we eradicated smallpox in India, and I returned to CDC in Atlanta, but then Bangladesh exploded, and off I went to WHO in Bangladesh, and like everyone else in the world, we watched smallpox disappear. Now, once you've done something like that around the world, where there is really essentially no health care, and you have a 40% fatal disease, and it's gone, I wasn't really thinking about going back and practicing pediatrics any longer. I didn't even recognize it, to be honest. So we had no more smallpox, except there was an outbreak in Somalia, and we finished that, and it was done. And I could go back home. But then, of course, the phone rings again in this game, and there's a new virus in where I was the head of the program in Sudan and knew the country very well, spoke some Arabic, and they said that this new virus in the south, didn't know what it was. Would I be willing to go? And I was already starting another career, and they said, sure, I'll go for, what was it? So they wanted for 2 weeks. I said, okay, I'll go for 2 weeks. Well, it ended up to be Ebola, the first outbreak of Ebola in the south of Sudan, and was certainly more than, I was in quarantine for 2 weeks. A WHO, this was a WHO assignment. Indeed, um, they threw me in quarantine. I said we were done, we finished the outbreak, and I wanted to come back home. And the world said, no, you're going to go in quarantine for 2 weeks. And where did they send me in quarantine? In the south of Sudan, where the outbreak was. And the people in South Sudan said, oh, big deal. Well, so I continued all my epidemiologic work outside of quarantine during the day, would go around to the hospitals and such, and go back into quarantine at night. And this was a WHO person in WHO quarantine. And when it was done, I literally did not even visit the obnoxious WHO officer in Khartoum. I just got on the airplane and flew back home. In the end, this was a very bad outbreak, published in Bulletin WHO, first outbreak, which was a highly fatal disease, obviously, that was very well both worked up and controlled there. So I went back to CDC and joined the hepatitis division. One of the reasons was it was in Arizona instead of Atlanta. But after, what was it, 2 years in Arizona, the CDC, or the government, decided that they were going to close the government facilities outside of Atlanta. So I ended up coming back to head up the division in Atlanta, which was fine. But we did the remarkable work with the new hepatitis B vaccine at the time, initially plasma and then recombinant, doing the initial work with the effectiveness of the vaccine to prevent this god-awful disease, which, by the way, my interest in this, I didn't put in the middle here, that I went for my, after coming back from smallpox, I asked CDC to send me to back for some education, and I went to Harvard for, quote, 2 years of infectious disease, but was pulled out for another outbreak. But I was studying, I was interested in chronic viral infections, and of all things, I studied feline leukemia, which we will enjoy, which was a retrovirus causing acute disease, but more importantly for my interest was chronic immunosuppression of cats. And so after I finished that, came back and joined the hepatitis division, which was about as close as you could get to a chronic disease. But here my background was a retrovirus causing immunosuppression. Well, you can imagine what happened in the long run with that. Anyway, in the meantime, we vaccinated the world against hepatitis B, and it was remarkable. But then, here with my background in immunosuppressive disease in cats, with chronic manifestations of pneumocystis-like disease, comes this interesting article on June 5th, 1981 in the United States, and clearly got my interest, not to mention CDC's interest in a immunosuppressive disease transmitted here in gay men, but very crookedly we saw around the world, that it was AIDS, and rapidly got the name of AIDS, of acquired immune deficiency, and we worked up the epidemic quickly and saw how it was spread, and relatively rapidly started seeing the natural history of it. Not only how many people had died, but we had now the CD4 test available, where we saw the potential of what this disease was going to do in the future. And even though which 20% mortality was huge, we saw that it looked like this was approaching 100% fatal disease. So it was from the beginning a very serious, but interestingly, from my standpoint, coming from feline leukemia and then hepatitis B, I mean, the real mortality of hepatitis B is cancer of the liver 30 years later. So we were already starting to really see the late manifestations of these viral infections, and this one fit, yet the mortality looked higher than any other disease that we had known. So clearly, with this, it was we needed to really, one, understand it and launch prevention programs to stop this disease. And so the plans were made to make a major $21 billion prevention program for the United States of America, targeting gay men and IV drug users primarily, but ultimately the entire population. And that from CDC went to Washington. And you know exactly what happened after that. The Reagan administration refused to fund it at all. And they said, literally told me to look pretty and do as little as you can. And for us in infectious disease, this was not a gay disease or an IV drug user disease. It was an infectious disease. It was spreading. And it was immaterial of what the groups were. These bugs do not stay in those groups. If you want to kill them, that's your political desire. But these were humans, and we know humans transmit the disease to others. And here we had been studying HIV vaccine in gay men for years, and so we had all of this blood in our freezers from gay men around the country that we did a hepatitis B vaccine study, and we went back and looked at the infection rate in gay men throughout the United States, and it was incredible. Of a disease that we knew at least an 80, if not 90% mortality, which turned out to be 100%. And so we sent that plan up to the Reagan administration. And in California, you know very well that there are doofuses in upper administrations, but these guys were really idiots, and they deserve to be hung. And they've never been criticized for this kind of bullshit. So I think when Randy Schultz, I spent a lot of time with Randy Schultz giving him all the inside. And when he wrote the book and the band played on, I knew it'd probably be better for me at that point to retire from CDC, and did. It was a wise thing ultimately to go out and look for other ways to prevent diseases. But realize that I spent 21 years fighting these bugs around the world, and so I was really devoted to continue fighting bugs. And I decided to initially, as a consultant, to work with Genentech, and ultimately became an employee of Genentech working on vaccines. And then Genentech, many of you probably don't realize that vaccines are very good business in our public health arena. They are not good business in the pharmaceutical arena. You can make a lot more money in the Western world by selling drugs to treat diseases, however effective. Not, and certainly for HIV, they were minimally effective at that time. But you can make more money. I mean, you couldn't ask for a better drug than having HIV with essentially 100% fatal disease, and you have to take a drug for the rest of your life. Not looking at it good from the patient, but good from pharmaceutical industry. So this industry versus government is a conflict that we will always have. Unfortunately, industry has the strength and the finance, and public health has a minimum of both. Anyway, so we took on, since Genentech didn't want to do vaccines, I was, with all my great private sector experience over the years, I was asked to start a company and raise, at that time, $25 million to start HIV vaccine development, and found the right people to join and do it. And this takes years to do it while the disease rages on. So again, it was the only way around it. But anyway, we moved ahead with vaccines, initially at Genentech. These are the other vaccines that were started with HIV vaccines, but really only the last one at the bottom, Sanofi and Global Solutions for Infectious Diseases, which is the one a company that we ultimately started. And we had, let me back up from that. The results of these studies were terrible. And we did one in North America and in gay men, and the other one in Thailand in IV drug users. Classic placebo-controlled vaccine study in North America, and the rest of these with Merck, and the other vaccines failed. But interestingly, in Thailand, with, of all people, intravenous drug users in Thailand for HIV was successful. And this was a prime with a Sanofi Alvac vaccine and a boost with our AIDS-Vax vaccine. And it was, oops, what was that? Oh, these are the different makeups of it. And this is a study way back in this takes years to do these vaccine studies, started in 2003 and ended in 2009. There was a prime with a canary pox vaccine and a boost with a recombinant envelope protein of HIV, both the B and the E subtype. And these are the placebos in red and green in vaccines. Not wonderful. You like the green to be flat down at the bottom, but ultimate efficacy of 30%, which is depressing, but a hell of a lot better than zero in the past. But that was the first successful HIV vaccine. And then WHO calls again, and this is pulls me out of the vaccine business for a while, and we start talking about eradication of polio. This is in 2005, and Jonas Salk did his vaccine in the 50s, and finally the world decides, let's see if we can get rid of polio. There's Jonas. He's a very interesting person to know and work with, unique to say the least. This was polio. It was really everywhere in the world. And the bottom line of this is we've essentially eradicated it, but this was the beginning of it, where these dots are the wild polio is type 1, the red, the blue is type 3, and the black is type 1 and 3, scattered around the world, and to go off and eliminate polio. And this is what you see even today, the older kids, but this is Bihar, India, where I work, and this is the when you take on a country, even a state of UP of what 90 million people in northern India, this is the vaccine supply that it takes to go out and deliver polio, and it's remarkable in that part of the world how you can deliver it, even 3 doses. And this is how you do it. You find every rickshaw, every little kid. It started, it was by young age groups originally, and but polio does not have a scar like a smallpox vaccine, so how do you tell you got a kid vaccinated? This was remarkably clever of WHO. You see that in his right hand there's a permanent marker, and so all you did was take his pinky finger and take the nail and paint it black, and it lasts long enough so that when you at that time we have such good outlook on vaccines that we did assessment. So you go back to the village, and a week or 2 after vaccination, you just go out and take a random selection of children, and you see if they got a black mark on their pinky, and if they don't, you raise hell. And very rapidly in India, you'll get every kid immunized after a few of those assessments. Remarkable. And here's the assessment. You can see that the 2 people in the front are part of our WHO team. Those guys with the frowns in the back are the vaccinators who are getting assessed in this village in India. And the kids are looking at me, taking a picture of the camera. Remarkable that a very readily transmittable, fecal-orally transmitted virus has been eradicated. This was after this slide, but we successfully, and we waited 2 years, and it looks like polio is truly eradicated. The challenge, interestingly, for those of you who know this well, is oral polio vaccine has a side effect of occasionally causing paralysis. And so clearly, as you get down to 0 cases of wild polio, you find that all of your cases of polio are caused by the vaccine. So at that point, you stop. And here is a final slide of history in action. Back in that slide is the Ganges River. This is me standing with a guy on the left, his grandpa. And you can see that he had smallpox, and he lost one eye with smallpox. His little granddaughter was absent muscles in one leg from polio. And ultimately, that's the end of it. So let me just back up. So that was wonderful. Now we have new things with Zika, as you all well know, so I thought I should put this in here and how the remarkable cases of Zika around the world. And then, just for your information, I I was really upset after all of these years of how public health cannot get the job done because of the government leaders that we have that cannot leave public health alone or stimulate it. And so if you want to see American Journal of Public Health several years ago, it's how to insulate, how to have, essentially, interestingly, when I came to California, we still had a kind of the equivalent of a board of health. And I used to hate talking to these folks who were sitting in, little did I understand how important the board of health is to, if you can keep it out of the political arena and just say the truth for the health of the people and embarrass the politicians to do their job right. So thank you